Sure. Welcome everyone to the third and final workshop sprint for community-based system dynamics. There is a quick poll in the chat just to get information. It's not to be, judgmental or anything. It's just to get information so that we have kind of a choose your own adventure piece of the lecture, and so it's just to help us with that. So if you can fill that out, and Rihanna, if you can just post it one more time in case anyone joined late, they can go to that link and fill it out. And while Rihanna is doing that, I will share my screen and we can get started. All right, can everybody see the slideshow in presenter mode, I should say?
Yes, I can see it.
Great, wonderful. And I'm going to minimize you all so that you're not blocking the slides, but if Rihanna or Christopher just keep monitor the chat in case there are any questions, that would be great. Okay, so as I mentioned, today is the third and last kind of workshop sprint on community-based system dynamics. And we're really going to start with a recap of session 2, which will include kind of what we covered in session 1. So we kind of just have a grounding for like how far we've come in our few months of kind of focus and talking about this method. And then we're going to transition into questions of the homework activity. And that's why I'm trying to get a sense of who's done it, because we can have two options for how we proceed with questions on the homework activity. It's really just kind of reinforcing those skills for how to do causal loop diagrams. And so we can either do an active live and, kind of engagement with those homework questions, or we can kind of reflect on what folks have, the answers that folks try to kind of put into the homework and answer any questions with regards to that. And then we'll go into a short, it's not even a lecture, it's just kind of like a rounding out of tips for stakeholder engagement. And that's following up on kind of our conversation of like, how do we take these methods and translate them into a group model building, a participatory and community engaged, community-based system dynamics context. And after that, we'll have a short group activity around bring your own problem. And even if you brought your own problem that you've just formulated, like are just formulating right now, it'll still be a great time to just workshop with your colleagues, like thinking through different stages of not only a dynamic problem, but also a like if you're at different stages of like drawing out behavior over time graphs or got stuck with the causal loop diagram, it'll give you a short kind of framework to brainstorm kind of questions and get some feedback on that. So that's kind of the course for today. And then we'll round out with sharing and closing. All right, so as I mentioned, we're in session 3, and this is really kind of taking what we've learned so far, both in the lectures and in homework, excuse me, and trying to apply it in a more engaging and active way to your own problems that you all are wrangling with in your own context. And kind of bringing a little bit more group discussion to the kind of roundup of these materials. Christopher, if you could post the Padlet with questions, if you all have questions over the course of the lecture, or even just what we're going over, again, feel free to use the Padlet to post them or post them in the chat. Or I like to pause at kind of opportune times to get questions. So again, feel free to use whatever mechanism is comfortable for you to ask questions. This really is going to be more discussion focused. Just a reminder of our group agreements. I think most folks are names that I've seen before, so hopefully you've seen these. But again, just thinking about, trying it on, intent does not equal impact, practicing mindful listening, practicing self-focus, practicing both and in terms of both, realities, many realities can be true at once, and then kind of the move up, move back principle of like, if you talk a lot, maybe pause, and if you don't talk that much, think about speaking up or finding a mechanism that feels comfortable for you to engage with the material. All right, so I think we already posted this, but this will be a pause if um Rihanna, you can just post in the chat to me who's done this. I'll check in with that when we get to the homework section, and also can see who's has problems that are on their mind. But if you haven't already done the homework check-in poll, please just either capture the QR code or follow the link to do that. All right, so just a quick recap of the where we've been so far. So the reason we're on this journey is because there are complex problems that require a different set of tools to unpack and then address effectively compared to linear problems that align more with kind of like, you have one treatment or one exposure and one outcome, and changing that treatment linearly aligns with impacting the outcome, right? So complex problems are rather defined by the fact that they change over time, they're dynamic. They have delays between action and response that may make it hard to assess, like when you move one lever, what's the actual impact on the outcome you want to change? They have feedback loops linking factors together. So again, it's not linear relationships. It's these kind of loops that feedback and either amplify or stabilize things in ways that we may or may not want. They're history dependent because of those feedback loops. And they can produce counterintuitive behavior that can stymie our attempts to move forward to address whatever problem we're trying to solve. Furthermore, often complex problems show a bit of policy resistance. So, we have a policy that's going to address, factor X that's shown to be related to outcome Y, but there's this policy resistance. We may see change for a moment, but it may norm back to, again, its patterns over time that are defined by a complex set of feedback behaviors and history dependence of the problem. So that's kind of the context of why we're exploring these new tools in the first place. And of course, the iceberg allows us to think about when we're learning about each of these new kind of behavior over time graphs, causal loop diagrams, and even in terms of group facilitation, our goals are to move further down this iceberg from the events that we're used to engaging with to unpack patterns over time, the structure of the system, and ultimately the values, attitudes, or norms or mental models driving the system behavior. And again, mental models are just kind of these core elements of what we're trying to elicit, especially when we're in a group model building or participatory context. It's going back to mental models are how we think things work, our internal conceptualization of the external world and our experiences in the world. And as we kind of discussed with the elephant example, all of us can have different mental models, and those mental models can be correct for where we're positioned in the system. But in order to get over kind of the unintended consequences that happen when we operate just from our lens, we actually need to iterate kind of different perspectives, different mental models across the system to actually understand how the system is working. That's kind of like you need all of the people around the elephant to understand that it's an elephant and how to engage with it. And that kind of need to iterate across mental models led us to our participatory system dynamics context. And that's where we've been really talking about group model building and the community-based system dynamics as a subset of group model building that really focuses on not only engaging communities, but community power building and oversight. So that's where so that's where community-based system dynamics is located. And finally, the effective around kind of the ways that we translate or start to build the tools to visualize those mental models are those, one of them is behavior over time graphs. of which one can be a reference model or reference mode that is a descriptive visualization of the dynamic behavior of our problem of interest, right? So this is just an example from the previous problem that we've been talking about around kind of bias in healthcare diagnosis algorithms, where the first step for saying, this is my mental model for how the problem is working, is just showing like, how do I think these are behaving in white populations and populations are patients of color. And so that is kind of one of the first building blocks we learned about how to visualize not only patterns over time, so going deeper on the iceberg, but how that relates to scripts when you want to do this across different mental models and start to elicit those mental models for system structure for multiple participants at once. All right. So behavior over time graphs also have an expanded kind of use in the context of going deeper on the iceberg. They really are a tool to just help illustrate mental models of patterns over time, so they can be used beyond just the variable that you're interested in or the outcome that you're interested in. In fact, you want to create them for all the variables that might be driving the problem of interest, right? So in this kind of heuristic, right? If we're thinking about the healthcare bias in AI context, there are all these different variables. And right now, this is just a heuristic. So they all have the same pattern over time, but you would draw a different behavioral pattern over time to start to understand, for the reference mode and how it's changing over time, how do these variables align with their changing over time? Are they increasing when the problem is decreasing? Are they decreasing when the problem is increasing? All of that leads us to changing those patterns over time into our system structure, which is the causal loop diagram that we learned how to create in session 2, which was back in October. And this is how we start to actually get at those structures of like, these variables are related in certain ways. And we learn the heuristics of causal loop diagrams in that, you know, arrows define relationships, the pluses and minuses define polarity, the hash marks define time delays between cause and effect, and the actual loops that emerge can either be reinforcing, so the starting behavior gets amplified, or they can be balancing, so the starting behavior gets counterbalanced or stabilized as we move across those causal chains. So I think, oh, there's one more thing that we talked about. How do we translate all these tools that help us move further down the iceberg into a process that works across multiple stakeholders that have different mental models and have different positionalities within a system? And that's where we got into talking about modeling in groups, and how do we design an engaging group model building process for multiple stakeholders, and how that really requires scripts, which are kind of these facilitation activities to help people move from their kind of linear thinking to their systems thinking, and facilitation as a process through which we work with a group of folks that we've kind of been pre-working with before the group model building session to successfully elicit a system structure from a larger set of stakeholders. And in our last discussion, we talked about the facilitation team can start with a core modeling team that works even before the day of a group model building session to say, what scripts do we need to think about? What like, how do we need to structure the learning activities successfully across the stakeholder dynamics in order to elicit a successful system structure for the stakeholders that we're interested in? So I will pause there and see if there's any questions around recap of any of those points of recap. I'm happy to answer them before we go on to talking about the homework. And I'll check I don't think there are any questions in the Padlet, but if there are any questions in the Padlet, hopefully someone will let me know.
No,
okay.
Okay. Thanks.
Great. Wonderful. Awesome. So that's the recap of where we've been. Where we went with the homework was practicing causal loop diagrams and also practicing applying the kind of thinking about stakeholder combinations for your own problem or for a problem. We did a little bit of practice of like, if you were to think about the stakeholder group that would be needed for, say, a healthcare bias AI problem, how would you think through the stakeholders there? So that was most of the homework. But I did want to have a choose your own adventure just to make sure that either like, people can engage, that we can all kind of like engage in understanding and kind of the process that was or the practice that was gained during the homework. So we can choose your own adventure. We can either break into small groups and practice CLDs by completing the ones in the homework. And actually, based on the size of this group, we could actually just kind of do that as a group. I've kind of copied and pasted the system structures that were on the homework into some extra slides, and we can use the annotate to kind of help complete the causal loop diagrams, or we can focus on reviewing kind of homework questions and discuss kind of the stakeholder choices for the bias in healthcare algorithms causal loop diagram. So we have a poll, but actually just because it's such a small group, would people be willing to like vote on, okay, if you want to do option A, can you put a thumbs up in the reactions? And if you want to do option B, maybe do a smiley face in the reactions. And I'll give you like a few minutes for option A or B. So, okay, A, got one vote for A. Okay, we'll do A. Hearing no objections, we will do A. All right, so for that, I'm gonna stop sharing for a second and go to some of those extra slides. No breakouts. All right, so for this problem, there are three, wait, why can I not? Oh, that's why you all are blocking the space. So there are three missing items. And starting, well, I guess I'll just say like starting with wherever folks want to start. Does anyone want to raise their hand and kind of volunteer the first missing item that they see on this causal loop diagram that would complete the diagram? And I'll draw it in while we're talking.
All right, so the first thing that I did was to make an arrow between drinking coffee and coffee consumed.
Okay, so that was going, which direction was the arrow going?
Drinking coffee to coffee consumed, and that it would
Okay.
be a negative relationship.
Okay, so drinking coffee.
The more coffee you drink, the less you need to consume, right? Okay.
So more, oh, wait, so the more coffee you drink,
then you don't need to keep consuming. Like you don't have to drink more.
oh, this is great. So that's actually kind of capturing, oh my goodness, this arrow thing is gonna kill me. Sorry, the arrows get kind of weird with this. So the more coffee you drink, so this is actually, so the less, so it's like you're almost kind of conflating the more coffee you drink, the less you need, but the less you need is actually this coffee gap right here. Okay. So actually the more coffee, so the air direction is correct, yes. And oh, who's making the coffee? Let's say it is your local barista, your favorite local barista here. That's making the coffee. Just to make it, more interesting. Sorry, I'm also learning things about.
So I mean,
Oh, Alan, yes. Did you have a question, Alan?
Yeah, so I'm new to this. So
great.
I want to know what size cup. So I don't know. I'm fixated on, to me, none of this matters if we don't know what size cup we're referring to. I mean, yeah. So in terms of missing items, that's some information. I don't know where that fits in.
Right. So
the scheme, is it relevant?
Not, so the cup could be relevant in kind of as in background information in terms of like, if we have a large coffee gap, we need to drink more coffee.
Mhm.
And so if the more coffee we drink, kind of going back to Jessica's question, so the more coffee we drink, the more coffee we will have consumed. So that's actually a positive direction relationship. And kind of in the background, if we want to increase the rate of change, so that's more kind of the how quickly are we closing the gap? That's where we would get into like how big is the cup of coffee. So that's where kind of the
Right.
size come in. But Jessica, does that make sense in terms of like the more coffee we drink, the more coffee we've consumed? So it's like breaking out that relationship that you're talking about around like the more coffee we drink, the less we need. And that's actually closing that coffee gap that we see for closing that coffee gap right here. Does that make sense? Jessica?
I do. No, I see.
Yeah.
What you're saying. Yes.
Yes.
I think I was separating out basically, I think I was conflating the coffee consumed starting with a later, like the next coffee consumed.
Oh,
Right.
okay.
Like, I
Okay.
think that's where my mind went, and I see what you mean in terms of like just skipping that entire, the coffee gap bit.
Right.
So thank you.
Yeah. So that's kind of the breaking out the like and because it's kind of like again, like it's shifting our mindset to like the more coffee, like we're not necessarily like we are thinking in cups in terms of operationalizing it, but in terms of total amount, it's just like we just want to know like the more coffee we drink, it means we've consumed more coffee and we need less coffee to close that coffee gap. Right. All right. And actually, Alan, you made me realize one thing that I have not done, which is I actually did not review the heuristics of causal loop diagrams. So I'm going to go back and review those heuristics really quick so that we can have be all on the same page for reviewing causal loop diagrams. So sorry for the dizziness here. We can start here. Apparently, I didn't realize that these stay after let's clear all drawings right now. All right, there we go. So for creating calls, oh my goodness, sorry, y'all. I'm gonna clear all drawings and then X out of annotate. All right. So for drawing causal loop diagrams, ignore the one here because that's just a heuristic of one that's on the graph. The first kind of element of a causal loop diagram is that there's two variables that are causally related. You draw the arrow from the variable that's causing the effect. So the variable that is the cause is on the flat end and the variable that's the effect is on the pointed end of the arrow. So that's kind of the first heuristic, and it's really demonstrating a causal relationship. Now, causal relationships have directionality, right? So as we were talking about, the more coffee you drink, the more coffee you will have consumed. And that is what we call a positive polarity relationship. And you can put a little plus on the end of the arrowhead. But it also means that the less coffee you drink, the less coffee you will have consumed. And so they're going in the same direction, even though both of those directions are down, meaning that it's still a positive polarity relationship because they're going in the same direction. They're having a synergistic effect on each other. Now, for negative polarity relationships, it means that kind of going to the coffee gap, the more coffee you will have consumed, the less big the gap is, the lower or smaller the gap is. So that's actually an opposite relationship. And so that's what we call a negative polarity relationship. So both of the cause and effect push in opposite directions. That also means the less coffee you've consumed, the larger that gap is, right? So anytime, and I do the hand jive just to like actually kind of, for me, it's a heuristic of which it's just a helpful tool to help me figure out polarity. So if your hands are going in this direction, it's a negative polarity relationship, regardless of which thumb is up and which thumb is down. It's still in a negatively polar relationship. And when they're both going up, they're both positive. And when they're both going down, it's still a positively polar relationship. Now, the little hash marks on the arrow lines means that there's a delay in the cause and effect. And if we think about our chicken and egg example, it's that, right? Like chickens hatch, but they don't immediately become, or eggs hatch and they don't immediately become grown chickens, right? So the chickens hatch and it takes a while, a time delay for them to actually become, or the eggs hatch, it takes a time delay for them to actually become full grown chickens. And so we denote that by having a double hash mark. And finally, the loops actually have this kind of directionality of like, when you're walking around a causal loop and the starting behavior is amplified, whether that's amplified positively or amplified negatively, that's still a reinforcing loop, right? So it's still saying you get more of what you started with at the beginning, or you continue the trend. Yeah, you get more of what you started with in the beginning. So you continue the trend of where you started. So we'll get into, I'll show an example of that on one of the other homework problems. And then a balancing loop is you actually, by going around the causal loop, you have a stabilizing, so you have an opposite behavior that's like pulling against the behavior you started with. So with the coffee example, the coffee gap, by consuming more coffee, you're actually decreasing the gap. And so it's balancing the behavior that was starting. So the coffee gap was increasing, you consume coffee, and then it starts decreasing. And that's why it's called a balancing loop. It's balancing the behavior that started. So those are the heuristics. And yeah, those are the heuristics. Play around with them. You don't have to master them now. We'll work on them in the examples that we go over in a few steps. All right, so now we're going to go back to the example. So again, we had the coffee example, the drinking coffee, the arrow went here, and it was plus here. All right, so there's one more missing element on this causal loop diagram. Does anyone want to take a guess as to what it is? And no worries if not, but yeah.
Positive relationship between the gap and drinking coffee.
Okay, great, yes.
So the more gap, the more drinking of coffee.
Yes. The more I have a gap, the more I'm like, I need to consume coffee and close this gap. So that is a positive polarity relationship. Yep. And so once we have all of the elements of the causal loop diagram, we can see why it's a balancing loop, because, right, we start out with coffee, our coffee gap is a certain size. The larger the coffee gap, the more coffee we drink, the more coffee we drink, the more coffee we've consumed. And that's where the more coffee we've consumed, the lower the gap is, because we're getting closer to the coffee that we need to function. All right. Does that make sense? Any questions? General confusions?
Yeah, I think for me, it might be maybe in the next examples, like a more like health related one might help me, or something like that, or yeah, some to
Something
make
like that,
more
yeah.
concrete of like this doing this community kind of systems design, community like systems mapping process.
Okay. The next one. So these are still a little bit abstract. So maybe we can go to, I'll just show the solutions for these, and then we can go to the actual, back to the AI example, and that might help make sense of some of these. So I'm going to erase the solutions from this one. So this is another kind of, This is another kind of standard example in system dynamics with just practicing with loop dynamics. So if we have these two, population, births, and deaths, there are 4 missing items here. And the first one is that this loop, the populations and birth relationship is a reinforcing loop. So the more population you have, the more births you have, the more births you have, the more populations you have. And so the only missing thing there was to put a reinforcing loop on this in here. So here is the reinforcing loop. Now, the next element missing from this was that as you have more populations, right, you also have more deaths. So if we go here to population deaths, there's just a missing arrow right here. Again, that positively polar relationship. And the final thing missing from this graph was that as you have more deaths, you have less population. And we can kind of guess that from like, if there's a balancing loop and one arrow is positive, then the other arrow is going to be negative. And so we can just draw that in. And here is, oops, sorry, y'all. This is a negative polar relationship, right? And so that's kind of, that's how that got filled out and for that horn problem. To get to a more health-related one, maybe we can spend a little bit of time, and we might cut the, oh, is there a question? We might cut the choose your own adventure one just to make sure that we have enough time for, okay, great, wonderful. We have time to talk through kind of these polarities in a more health relevant context. So we'll go back to the homework example with the actual AI example to kind of get to some more health related examples, right? So here is the kind of, we worked on this a little bit in the previous lecture, but the goal was to fill this in. And there are actually 14 missing elements, and we don't have to identify all 14, but if folks can volunteer, like if we're looking at the association between, let's start with just like accuracy of existing data on diseases and doctors' assessment of symptoms. How might we start with like understanding the relationship between these two factors to fill in the kind of feedback loop that might be here? And if anyone did this, they can volunteer, or if anyone wants to take a guess, what's the directionality of the arrow between accuracy of existing data on diseases and doctors' assessment of symptoms? Any guesses? All right, Jessica.
Sorry, I'm trying to give time for other people to respond
No
if they would like to. So I put that arrow from accuracy of existing data pointing to the doctor's assessment.
Okay, great, yes. And so that's saying that, sorry. And so that's saying that
if the existing data is accurate, that will have hypothetically an impact or causal impact or relationship on the doctor's ability to assess the symptoms.
Great, wonderful. What polarity did you put on that relationship?
I said positive.
Okay.
Because the higher the accuracy of the data, the better the assessment should be.
Great, wonderful. And so if that's positive, actually, okay, so there's a little bit more information that we need to close this loop. What was the next kind of piece that you filled in? All right, and if anyone wants to jump in, what was the next piece that they filled in, or another missing element of the graph? Maybe we can start to think about like how we build reinforcing loops and balancing loops. Oh, Ariana?
Yes, I have a line going from treatment with the arrow pointing toward patient symptoms.
Okay, great, wonderful. So you're here and it's going to patient symptoms. What polarity do you think this relationship is? Or like, as we get more treatment, yeah.
Yep, I have a negative polarity. So as there's more treatment, there should be hypothetically a decrease in patient symptoms.
Great, so that's a negative polar relationship, as you said. Wonderful. All right. There we go. Sorry. We'll get these drawing tools. Sorry, drawing tools are interesting in presentation mode. All right, so that's a negatively polar relationship that looks very much like a 5-year-old's drawing, but that's a negative. All right, so for what other pieces are missing on that on the diagram that people added? Or could add now, like as you're looking at the diagram, what else is missing?
All right, so I know that there's got to be something between the diagnosis accuracy and the accuracy of historical data.
Okay, so which direction do you think that's going in? And people can chime in and kind of share what they thought as well. So diagnosis accuracy.
Yeah. So we're gonna. Okay, yeah, I'm gonna call in a friend. I think I need some support on this one because I'm like, eh.
Anybody want to assist with diagnosis accuracy and accuracy of historical data on disease?
I think it's a positive relationship. So the more accurate your diagnoses are, the more accurate your historical data should get.
Okay, great. So you have this going this way. And there's a plus there that I'm hearing. But there was one other element of your statement. So as diagnosis accuracy is more accurate, the more accurate your historical data will be. But is that an immediate process? Great. Because it's like almost like a time loop kind of thing where it's like your actions now will affect history in the future. So anytime you have these kind of time delayed activities, right, you can have a time delayed process. So that probably has a double hash on it. All right, does that make sense to people? Any questions? Jessica, Ariane, Terry, Elizabeth?
Irene, a question I'm having is like, so, we're doing this, and then in the context of the community work, like, right, like we have stakeholders, are we like facilitating this conversation with them?
Yes, exactly. And that's kind of what the scripts help you do, as well as like you're building your own capacity to like, get through the polarities. And there's going to be there's a cheat sheet, and also in the homeworks, there are a lot of the short briefs that help you like figure out for yourself how to lead communities through that. But all of the scripts are designed to help you take communities or take your stakeholders through this process on their own. So yeah. So we'll do one more piece of this, and then we'll actually just kind of skip to that piece of it, because I think that, great, wonderful. I think that piece might help solidify how do we take these capabilities that we're building by ourselves that are really challenging to a community context, right? So the final thing I'll highlight is that we actually now do have a closed loop. So from accuracy of existing data that improves doctors' assessment of symptoms, that improvement of assessment of symptoms improves the diagnosis accuracy, that improved diagnosis accuracy improves the accuracy of historical data as that happens over time. And as we have improved access to historical data, the current access to existing data on disease is actually better, right? So we have an actual reinforcing loop that operates on a time delay to improve algorithmic performance. But that time delay is an important element because we won't see those improvements for a while. And so if it's operating in a positive direction, that's great. But if that's operating in a negative direction, we may not catch that we're diverging from having accurate data for a subpopulation until much, much later. So anyway, that's a tool to, that's kind of playing around with doing causal loop diagrams. I do have the solution to the causal loop diagram that I presented, but this is not one, like there can be many solutions just because this one's representing my mental model. So this is not to say like if you did something different, it's necessarily wrong. It's just saying there's a different mental model at work. But it's just to help in terms of like learning, going from seeing a problem and then doing a problem. So these are the solutions to the thing, right? We had Oh, I think I had that in the opposite direction, but again, that can be in this direction. The diagnosis accuracy could improve the accuracy of historical data over time, and we could have a loop there. The patient symptoms loop is a balancing loop. I had a time delay because sometimes there's a delay between treatment and patient symptoms, but that's also representing my mental model. There are often a lot of treatments where you get them and the symptoms are, cured almost instantaneously. So this is just one of many solutions, but just to help you think through what story is this telling in relationship to the pieces that we're missing on the diagram. So that'll be in the homework. Right, I'm going to pause for questions because the next piece that I think we'll go to is like continuing to translate these elements in the homework that are kind of like a little bit hard to kind of wrap your head around, to continuing that conversation around what does this look like when you're facilitating this in a group. So I'll pause for any questions or any other kind of things that are coming up around, community-based system dynamics, causal loop diagrams, and whatnot.
There's something, first, thanks for all this. This is interesting because as you're talking about the mental models, like I'm already imagining like different stakeholders are going to have different mental models of the same problem. And I guess like the gift of this method is that like you're putting all those things into one conversation.
Yes.
So that like you are getting this big systems understanding of the problem versus, it's not just one mental model, it's now this larger co-created mental model. And I mean, pretty fascinating for like intervention development.
Exactly. And that kind of jumps to one of the elements on, actually that jumps back to one of the elements, on be patient with me on this kind of like the logic of a group model building workshop design. So that causal loop diagram that I just presented, right? Say that was what we all broke into groups and made causal loop diagrams on healthcare bias. That would be in this, right? The CLD. Can you all see my cursor moving? Okay. That's right there where it's like you have multiple groups creating CLDs on the same problem. So one group might have an arrow going from diagnosis accuracy to historical data. The other group might have it going in another direction. And it's in this synthesis of CLD section that will talk about how to facilitate that. And that's why facilitation is so important, where we start to iterate around the shared pieces of the causal loop diagram, as well as how do we hold the disparate pieces, right? Because it's not necessarily about synthesizing to lose voices, which can happen, but synthesizing to capture the breadth of voices and mental models. So this heuristic is really kind of going between like, everybody's creating causal loop diagrams, and through facilitation, we synthesize those causal loop diagrams while maintaining engagement, empowerment, and ownership of the models. And that's kind of where the facilitation piece comes in as being important. So again, sorry for the quick moving through things. The next thing I want to talk about in terms of like taking those activities and translating them into an actual group model building session, we started talking a little bit about, facilitation, in terms of the core modeling team, having those be representatives of the group that you're working with that can help you think through, like people are not going to get that example, or we should use this example or this type of language when presenting these tools in order to actually have a successful group model building session. But they're one piece of the facilitation team. In order to do the actual group model building session, you have a whole host of roles, and this is covered in the readings that you also have access to, so you can revisit this at any time, but you have a whole host of roles of folks who have been trained in these systems tools, similar to how you all have been trained, but it's like kind of a longer training with a lot more hands-on activities, and usually in person, which helps a lot. but the facilitation group actually builds their own capabilities to then translate these activities to the stakeholder group that you're working with, right? So you're going to have a convener and a closer and a community facilitator. Usually those are community members. So in a recent group model building session that I did with Black-led community-based organizations here in Philadelphia doing maternal health work, the community convener and community facilitator were actually owners of Black-led community-based organizations, where we've worked with them over a period of 3 months really to like train them in these skills. So like that's kind of the scale of training that you need to like get people up to speed. But we trained them in order to help them facilitate the conversation that we were then going to have with a larger set of the CBO community in Philadelphia, right? There's a model facilitator, which is myself or anyone with the capacities or capabilities in in system dynamics and group model building, which hopefully will eventually be you all if you continue your SD journey. There's what's called a theme builder. So as say we were kind of doing behavior over time graphs, right? And everybody was showing like what mental models they had by the variables that they listed. The theme builder would, you know, in the share out section, kind of take those different variables and say like, oh, I see a theme around income, or I see a theme around data access, or I see a theme around symptom identification, right? For the different types of variables that are coming out. And that's a really great way to involve community members that may not have the time to get to like a Jedi level of SD understanding, right? But they still want to be involved, right? So that's a great way to get them involved in kind of identifying the threads that are similar and different across the mental models that are being elicited in the group context. Then you often have a runner, which is just helping move things in different places in the group model building session, because the scripts have like, we'll have like a whole wall of the behavior over time graphs. We'll have a whole wall of different causal loop diagrams. And so as we're kind of synthesizing across those different, what we call artifacts, the runner can move materials in order to allow the facilitators to manage different pieces of the group dynamics. And especially for kind of power balances, that can be very important. And then we have reflector and note takers or recorders, which again, those can be folks from the community that again, may not have Jedi level, but may want to be involved in the process. And it's a great way for people to reflect on what does this mean for how we then engage in translating this information into action, right? And so these are the facilitation team members. And the way you get them up to speed is like the way I got into group model building was I was a community facilitator for a group model building session at a Data for Black Lives event, right? And so I had no idea, I knew what system dynamics was, I had no idea how to do it. And over like a 1.5-day session of doing these activities, learning these materials, and then a 2-month planning period, I came up to speed and was able to do the community facilitator role. And then through building those capacities, I was able to continue to build my skills. And again, this is iterative. Again, surprise, it has feedback. And so there's a way in which these facilitation roles are dynamic, and you can grow in those facilitation roles. So one important thing to think about during facilitation is that you have all of these different members to help you elicit both system structure as well as manage and maintain power and ownership dynamics, but there's some kind of key tips in terms of wanting to maintain that. So first, you want to maintain the language of participants as much as possible, including their stories about the loops they share. So again, going back to that bias in an AI loop, if there were different like ways that people were talking about those variables, we'd want to keep that language as close to their language as possible so that we're not putting words into community members' mouths, right? And again, the facilitation team can help with that process. You want to, when you're aggregating variables in that synthesis section, you want to do it with caution, because aggregation and merging should go at the pace of capabilities, right? So if people aren't getting like why these two causal relationships are the same, or why we need to condense this, then don't, right? Keep it at the size of the model that represents the identities in the room, right? So it's very important to, again, go at the pace of capability building. And also a lot of times having live editing where you're actually changing the model or smushing the models together in real time can help with that. So one of the model synthesis scripts is actually like you taking drawings of models that each group has done and actually synthesizing it in real time while they're looking at what's going on, so that they understand the process and can say, oh, whoa, stop, like that doesn't, those things shouldn't go together. Those are actually different processes, or like, I feel like my voice is being lost in this kind of synthesis. So it's really having live editing and kind of doing live editing scripts can be really helpful for maintaining ownership of the model. All right, and finally, changes to model increase the time you need to maintain ownership. And so again, you want to balance that time in collaboration with your facilitation team and in collaboration with your core modeling team to know, like, if we change the language in this variable in a way that we think is trivial, how much might that change how much the stakeholder group sees themselves in the model? And that may differ for the different stakeholder groups that you're working with. So you may need some iterative engagement as you're synthesizing models in order to make sure that everyone is represented in the most kind of succinct way possible. Trust is a very big piece of managing this. And again, why the facilitation team is as important as the actual scripts that you're doing in order to elicit system structure. All right, the final thing that I think is important to mention about facilitation and stakeholder identification is that while there's a whole host of system dynamics tools that helps get people up to speed, there are also a whole host of tools for identifying stakeholders and kind of thinking about stakeholder management that are outside of SD that can still be useful. So there's some really great tools from design thinking and kind of discourse and dialogue work that can be useful in mapping out stakeholder dynamics that are going to be important for eliciting system structure, right? So one of the tools that we use is relationship mapping, even before we do the group model building session, and thinking about recruiting stakeholders so that we have an understanding of patterns of interaction, perception, and stereotypes that are existing, so that we can make sure that the way that we design our great, wonderful. So that we can design our workshops with those tools in mind, right? So that we're managing the right elements of ownership as well as engagement, so that everyone around the elephant can feel heard and feel like they have ownership of what's eventually being created and what then happens with that model. So this is just a placeholder for, like, there's a lot of space for non-SD tools being merged with SD tools in order to facilitate a successful group model building session, as well as a community-based system dynamics kind of series. All right, so I will pause there because that's basically the end of the lecture. There was an activity around kind of share your own problem. But I think in terms of just like wanting to sit with like all of the loop building that we did, we'll kind of skip over that, but that will be in your packet. So if you want to kind of think through your problem in a dynamic way, that will give you the tools to do so with a small group. So I'll pause for any questions about just like, you know, how do you go from the tools that we're talking about to doing this in a group? What have been important, you know, like lessons learned for me for like stakeholder management and identification, and how to do this successfully in groups. So.
Do you folks have any questions on kind of the process of doing this? Thanks, Erin, for opening it up.
And no worries if not, sorry. Just always want to pause because I know I both talk fast and it's a confusing topic. So,
just quick question.
Yep.
How do you know where to put stuff in the causal loop diagram? Like literally writing it out. So the one problem in the homework was like, redo this, but like through the experience of a Black woman or like this kind of stuff. And I had to like recreate the model, and I'm like, oh my God, this is immediately a mess.
Yes.
So instantaneously,
yes,
looking like a disaster.
Yes. So I will say part of the early learning piece is drawing with a pencil, which was not well demonstrated in the homework, because, right, like in terms of like getting the causal relationships, I feel like that's the first piece. Like even if it's a mess and like things are crossing each other, getting those causal relationships is kind of the first step. And it is a little bit of a mess. I think one of the things that helped me, and this is some of the resources that were in the homework, but I also will send more resources on how to do this after at the close of the closeout materials for the session, are translating some of those drawings, so like paper and or pencil and paper drawings, into software such as VinSim can help, because they'll keep all the connections in their messy formats, but as you move a variable, the whole, like, you don't lose the connections to the other variables, right? So you can start to see the loops emerge in a way where you can play around, like, oh, if I move this to see this loop better, does that obscure a different thing? And so I think it's this toggling between having very messy and, drawing and redrawing system structures on paper for a while, right? That was one of my practices for a long time, just kind of drawing and then redrawing once I could see the arrows, and then putting into kind of software I could just kind of move things with a little bit more flexibility. That was really helpful for learning how to and where to start. I think that's also kind of hard, where it's like, at some point you just have to start with like variables on a page, and that's kind of the place to start. But that can also be overwhelming. In the post materials, I'll also link to kind of practice resources, because sometimes it's helpful to have like a causal loop diagram where there's a solution, but you start with just the description of it and start to try to draw those. And it's just through like practicing drawing the causal loop diagrams and then looking at, okay, like how did this get represented in the solution? That also helps with just figuring out, like getting an intuition of like where to start, or how to wade through the many kind of messy iterations of causal loop diagrams that will occur. So great. Terry, I see your question. Oh, yeah. I see your question on what do you do if and when you face pushback from local stakeholders? I think that's a great question. And I think it's working with the core modeling team is a great kind of initial, when you're thinking about presenting these methods to a group that you're interested in. If they have pushback, they can help you sort through or work through the pushback that you may receive. So for example, when I was working with community-based organizations, for the core modeling team, we had frequent pauses over the kind of learning of system dynamics and learning of systems tools to say, like, okay, if we present this tool, is this useful? Does this capture things in a useful way? Or is this just going to be seen as kind of like more tools from an academic institution that aren't going to be useful, right? So we had those conversations up front. And that helped with kind of smoothing that kind of, because we did get pushback on like, what's the point? Like literally just like, what's the point of this tool? Like what's going to come out of this in a practical way that's useful for us? And our kind of work with the core modeling team helped with that, right? But there's also a way in which working with community facilitators to navigate and know what are the relationships in the room, know what's the friction in the room, can help you, again, know when to pause. If there's a lot of friction coming up on like behavior over time graphs, you don't have to rush to causal loop diagrams, right? Like you can take a moment and then say, okay, we need to do some dialogue work. We need to do some debriefing. We need to do some community building or using other tools that are just kind of good facilitation tools to, oh yeah, that's fine, Jessica, thank you. There'll be some post materials that hopefully you'll get. Anyway, so that you can then do in order to, again, manage these dynamics as both they're coming up and as you anticipate them. So does that make sense? And then if you're getting a lot of pushback on this method from stakeholders going forward, it may be like, maybe systems isn't the right thing to do. Maybe it's just kind of supporting them in other ways at that time for the relationship building that's needed at that moment. So this is like, again, a tool in a larger tool of how do we solve and how do we address community problems, or kind of community building and community health issues. So, yep, great. All right. So that's all. We are out of time, as Jessica indicated. It would be lovely if you all could do the QR code, and maybe we can put the link in the chat, while I also go over just some parting tips. So basically, you've gone through a brief, quick and dirty how to do community-based system dynamics and system dynamics tools for community engagement with health equity challenges. But this is just the beginning, right? The next step, I think, is really, if you want to continue with these methods, and it's totally fine if not, like you can be like, this is great. I'll come back in a year or two when I have time or when it makes more sense. But if you want to continue on with this training or learning about these methods, there are a number of communities of practice that I think are really great for continuing with your capabilities and capacity building around these tools. So one is a social system design lab, which is where the briefs came from. They have a whole host of trainings and resources on their website. Also, there's a whole host of resources for K through 12 teachers that are actually teaching these methods in different contexts, so more around climate change and whatnot, but similar methods in their K through 12 courses. And so they have really accessible resources and videos and practice examples that can be really helpful for just learning how to practice. And then also I've posted some self-guided learning resources. And so that's all I really had. Oh, okay. So we need to change the access to the form for the feedback. But that's all I really had. I'm going to stop sharing and just really thank you all for sticking with me through this kind of learning series. If you have any questions or want to, again, continue the conversation, hopefully, I think you have my email address. I'm happy to either workshop stuff with you or just direct you to communities of practice that may be helpful for you, helping to learn how to do these activities in real time. So
thank you so very, very much. This was wonderful.
I'm so glad it's useful. And also they're recordings, so you can revisit the recordings whenever you would like. So
will the extra materials be on that same web link that the current materials are on, the slides and the homework? Will they be in the same place?
Yeah, we will share a robust toolkit from all this. It's going to take us a little bit of time. So what we do, just to share in the recording for everyone, is we kind of synthesize each session into a little one-pager. So you're going to get like a little document that kind of walks you through what was a new session, resources related to the session. You'll get those 3 recordings. You'll get all slides, all homeworks, all other resources. Yes, and that's all just going to live in like one page on the Partner to Advancing Health Equity website, which we will send to all of you. And so all of our workshops we do are on there, and you have access to everything.
I don't know who funded this, but please send along thank you. This was just a gift.
Yeah.
I'm so glad.
Really appreciate it.
Very good. Well, maybe Elizabeth, I'll reach out to you personally, because maybe we could have you send the Robo Johnson Foundation a lovely message to be like, hey, this thing, they're doing cool stuff.
I'd be happy to do that.
Yeah. So wonderful. Yeah, Irene, thank you so much. I'm excited to use this more in my own work as I do systems and community systems dynamics. So lovely. I can't wait to share with others.
Great. All right,
Thanks for coming, everyone.